Is it my slide is visible completely?
Yes, sir.
Okay. So once again, today we will discuss about qualitative research in qualitative method of research in health research, in especially related to health field. So myself, Dr. Ajay Kumar, assistant professor in the Department of Swasthorukta, uh, LRK Ayurveda Medical College, Islampur, Maharashtra. So before going to topic, just I will introduce why I have taken this particular qualitative research method for this today's workshop. Because as from my PG days and now also, I have not gone through this qualitative research of activities in my field, or I have not seen any person they are doing qualitative research. So far, I have uh, created somewhat interested what is qualitative research, because most of the researcher or we prefer the quantitative research, clinical research as kind of our interest, but many times we will ignore this qualitative research, as we have the preconception like that qualitative research is very low value, that kind of low category kind of research, so it does not give any uh, input, or that kind of concepts are there in our mind. But when I gone through particular workshops and particular resources, I feel that many people are conducting qualitative research in Ayurveda field. Also, qualitative research is conducting by some other people, other foreign students, foreign health persons are doing the health system Ayurveda related to Ayurveda related qualitative research. But I have not found any research papers. Our own people are conducting qualitative research. They may be conducting, but I have not found. So I thought just why the qualitative research is neglected, because many of us we will not study in detail, and it is very difficult to conduct also because of certain methodologies and concepts. That's why today's session I will make somewhat understand the basic introduction about qualitative research. It will helpful for the PG scholars and researcher and faculty to create the awareness to do the qualitative research in our field. So that is my agenda, or that is my intention to take this particular workshop. So before going to in detail, just I will introduce what is qualitative research. So as all of we know, types of research, many kind of types of research we will study. Uh, Observational, interventional, like qualitative, quantitative. So many types of research are there. Whenever it comes to research, we will more focus on the quantitative research. So today we will know what is qualitative research, what are the things we will do in the qualitative research. So if you want to study the real life situation, or whatever thing in the social, actually the qualitative research has its base in the sociology and anthropology. So in the context of medical field or health research, if you want to bring the qualitative research, we should know some basics about the qualitative research, where the sociology people and anthropology people are using this qualitative research extensively. But all the concept, theories, methodologies, we may not use because we are as a medical field. But some part of the methods and concept we will use to uh, do qualitative research in our health field. So qualitative research is basically to study the real life situation and in depth. Specifically in this qualitative research also, many types are there. Some study will some kind of studies will do the superficial findings. Someone some kind of studies will do the extensively deeper level of qualitative researches. And qualitative study focuses on understanding how and why things happen. So I will explain in detail, just as it is an introductory part. And in qualitative research, we use the words, stories, and observations instead of numbers. So that is the qualitative research. So how qualitative research works compared to quantitative research? These are flexible and can adapt in the different situations. In qualitative research, creativity and careful thinking is needed. It will look detailed and different viewpoints of the particular phenomena without oversimplifying. So important points to remember in qualitative research is दरवाजे बंद कर दें. So important points to remember in this particular qualitative research are, as in quantitative methods, we have different kind of methods. We will before going to study, we will try particular method and we will go to that particular method. But in qualitative methods, no single method is available. Means we can use multiple methods to explore the single phenomena or single issue. And analyzation of this particular qualitative research needs the personal insights and clear thinking. If anyone conducting qualitative research, analyzing the qualitative research is depend on that particular researcher, his understanding and his thinking and his knowledge about that particular research question. So because analysis is depending on the researcher. In quantitative research, what happens if you collect the data and due to the statistician also, then also the result will be same. If you yourself also analyze the data, it will give the same result. But in qualitative research, the analyzation part is different for different person. If I analyze the particular data in qualitative, I may interpret or I may give some different outputs, and another person who is analyzing that particular research, he may give some different opinions. So that is possible in the qualitative research, because the qualitative analysis is involves the personal insight and clear thinking, and it will recognizes the interesting aspects and what are the challenges we feel in the studying in the social situation. So this is about introduction about qualitative research. We will, as we will move on, we will understand what exactly meaning of these things. So this is the one of the quote from James P. He is a scientist. So I want to understand the world from your point of view. So I want to know what you know in the way you know it. I want to understand the meaning of your experience, to walk in your shoes, to feel things as you feel them, to explain things as you explain them. Will you become my teacher and help me understand? So this is the one of the things given by this particular scientist, because in qualitative research we always focus on other person. What other person you will think about this particular phenomena or this particular condition, what the people or persons thinks, how they will feel it, how they experience it, how they understand it, how what is the meaning according to them. So if you ask what is Ayurveda, if you ask in a community, the different people or the different person have different kind of understanding about Ayurveda medical science. So the layman will understand different. Some educated person is understanding different. The women's in the village, they will understand different. Ayurveda means they will like their local medicine. So that kind of different kind of perception is there for a single matter or a single phenomena. People have different kind of opinions and perceptions. So that is the that is important in qualitative research. We are focusing what people will understand, what is the meaning according to people. So that is the qualitative research. So everything will be what uh, what will be understand from others perspective, you, not me. If I conducting any particular research interview, taking interview, my understanding, my views should be not interfere with the that particular participant. So we should keep our mind clear, and we should accept the whatever expression, feelings, opinion about that particular subject we will take in the qualitative research. So just we will see this particular video, whether audio is you will listen audio is audio. I am not sure, but I will play this video for 5 to 6 seconds. I have already shared this in the group also. You may also seen already. Just I am playing this video. So this is to just to try to explain what is the qualitative research by simple video watching. So when we see the things from different angles, we understand them differently. So this happens because of words. So before changing that particular board, I am a blind, I am can't see anything. So that kind of words are there. But after changing the words, I can't see the beautiful day like this. So many people are giving the money to that particular blind person. So here the because of change in the words, the understanding of the entire thing or situation may be changed. So the words are more important in the qualitative research. So every professional or every person can see the things from different angles to understand them differently. So this happens with us also, that professions also. So to assess the particular phenomena in this society or particular community, why the people are behaving differently with same kind of issue also. So because of this, the qualitative research is important. So as qualitative is about perception, so the here the image, uh, because of their angle, because of their view, they are arguing that this is 6, this is 9. So sometimes the people will pursue the knowledge of that particular phenomena according to their knowledge, experience, and their view. So this is also most important in qualitative research, because if you do the qualitative research, many people will understand the same phenomena in the different perspective, and they will give the information about that particular phenomena. So I have already shared this particular video. So I will just summarize the video. What is this particular video? So when we do qualitative research, uh, uh, or the different persons have different perception and different opinions about that particular phenomena. In this particular video, the one person dead body is seen, and many people will perceive how this murder is happened. So different kind of perception is there for different kind of people, and all are telling this may be the reason for this particular murder. So like that, everyone have different kind of perception. If you go through this particular video, you will understand. So which one, which person's opinion is correct, which one is correct, so how we can come to final conclusion. So this will all includes in the qualitative research. In this particular video, the one of the effect, that is Rashomon effect. So they have explained Rashomon effect means when individuals give the different kind of opinions regarding the same event. Because of this Rashomon effect in our brain, when we try to recall the things, it will somewhat not give the clear picture or whatever actually happened in that particular moment. So some kind of bias or some kind of opinions comes about that particular event based on our beliefs and experiences. So that one we call as a Rashomon effect. So that's why in qualitative research, when we interview any person, so we have to give some time to recall the that person. If you are asking any question or any phenomenal things to that person, we have to give the proper time, because the our brain needs to some time to recall the things, whatever happened in his life or whatever his opinions. So like that. So this Rashomon effect, because of Rashomon effect, so many people will pursue different kind of opinions, or they believe differently for same event. So that is the if you go through video detail, you will understand. So next, objectivity vs subjectivity. So if I ask to calculate the average mean of the mean hemoglobin of male patient and female mean of hemoglobin level of female patient, then if you calculate, all of you calculate this particular mean or average, it will be same for everyone. So this is quantitative research, or it is objective one. The answer will be same for everyone. But if I ask why females have poor diet diversity in spite of availability, so if I ask this particular question, so many of people are giving different kind of answer according to their experience and their knowledge and their belief. They will give the different kind of answer. So this is about subjectivity. So in subjectivity, the answer will differ from person to person based on their knowledge and their experience. So this is about subjectivity. In qualitative research, most of the time the subjectivity will work. So how they will pursue that particular thing or phenomena will work in the qualitative research. So in quantitative study, what we will do, we collect the data to test a theory. Uh, uh, Particularly, we will collect the data and to test the theory. But in qualitative study, we collect data to develop a theory or fill a gap in the theory. For example, if tuberculosis, in spite of a lot of national programs, still tuberculosis is a burden in the India, burden for the Indian population. So how many people are suffering from the tuberculosis? How many cases are coming? So to know this, we will study the quantitative study. But why people are not taking the proper medicines? Why the problem is not yet solved in India? So why questions? Why to know the that particular thing we have to go for qualitative study. So it will help to develop the theory and it will fill the gap in the theory. In sometimes what happens, quantitative study, we will get the result, but how this result came, how we received this particular result, we may not able to understand that particular result. Then by this particular qualitative research, we can understood why that particular quantitative study gives you that kind of result. So the qualitative study is basically about to develop a theory or to bridge the gap between the theory. But quantitative study, we will collect data and we already have theory. We just do the study for to prove that particular theory. So now came to proper definition of qualitative research. Qualitative research is defined as the investigation of a phenomena, typically in-depth and holistically, through collection of rich narrative materials using flexible research design. So qualitative research is a like kind of a investigation. It will go in depth and holistically, and collection of narrative materials using the flexible research design. Here we will not rigid about our research design. Sample size should be this much only. Sampling type will be this type only. So this kind of things are not there in the qualitative research. And qualitative research lies the addressing how and why research questions. If you have any research questions, it will solve how and why people are not taking this, why people are not coming this, how people will feel this particular phenomenon. So to addressing how and why research question, it is critical to understand experience phenomena and in a different context, different social context, economical context, different political context, how people's experience and perception will differ in that particular context. We will study in the qualitative research. So up to this, I am okay. Is it my language or thing is okay? Whether it is making sense or I can use some other form. Hello. Up to this, okay. Because this qualitative research, I am familiar with statistics or that kind of quantitative research, because to explain, to convey this qualitative research, it needs the more words and expression things. So even I am poor in that, so just I am making myself better to understand what is the qualitative research. But you will understand by I will provide some textbooks also. You can go through that also. After this particular workshop, if you can attend any workshop or if you go through any research paper, you are able to understand what is qualitative research. So that is my. So in qualitative research, three things we will see: what, how, and why. So these are the three questions generally we will use in the qualitative research. What kind of questions we will use? Understanding the what topic, what is the issue. It involves the what exactly you want to study or what is happening. So that kind of things. Here I have given two examples. First example, this one. These are general examples. Don't see this general example. See here example two. Many in medical settings, many people are patients and doctor communication is not happening properly. So now my research question is, what communication barriers exist between doctors and their patients? So many patients will complain what doctor is telling, he is not giving time, he is not explaining properly about my condition. So this kind of problems we see in the day-to-day practice. So my research question, I want to know what communication barriers exist between the doctors and their patients. So what here, what is happening, what I want to exactly study, what type of question will give the answer for what I want to know, what I want to study. For example, here, what communication barrier exists between doctors and their parents? If I ask this kind of question, the probable answer may be the language difference, medical jargon, cultural difference, lack of time, and misunderstanding instruments. So these are the things why the doctors and patients communication barrier. For example, language difference. The patient does not know the language of that particular doctor, or doctor does not know the local language. So this may be the communication barrier, or otherwise the patients will not understand the medical terminologies. So that is also possible. That is also one of the barrier to communication between patients and doctors. So this is about what is happening, what I want to know. Then how something happens or experience. It is the process by asking the question how, this will give the answer. So this investigate, just see for the example too. This investigates how these barriers affect the interaction or communication between doctors and patients. In first question, we know that the communication barrier is there. Then how this communication barrier impact the patients understanding their medical condition or treatments. So how will give the process. Now what doctors will do, doctors will do the attempt to overcome this communication barrier during consultation by, they may simplify their language, or sometimes they use the visual aids, or sometimes any other person who translates to explain what the doctor is saying to convey that particular things to the patient. So how this interaction will be processing what happens. So this is about process ways patterns. So how question will be explains how the overcoming from that particular situation. So we will clear about this what, how, and why later on. Just it is, as it is general concept, it may little bit confusion. Just for this moment, you just understand what, how, why. These three questions we will ask in the qualitative research. So how is the second question. Then later on, why understand. If you ask why, then we will understand the reasons behind the actions or that particular events. If you see the same second example, why communication barriers happen and why they are significant. So why do doctors continue using medical terminologies even when patients find it hard to understand? Because of habit. Doctors are habituated to using that particular words. So if you ask why, instead of patients are not understanding medical terms, the doctors are still explaining that particular condition of the patient in the medical words, because of habit or lack of awareness. The doctor might think that the patient will understand this medical terminologies, and lack of training also. So how to convey this medical terminologies to the patient in their way. So this kind of things. Why will give the reasons, motivations, or meaning why of that particular phenomena. So these three questions will be there in the qualitative research. Mostly how and why. We will focus the questions why, how, and why in the qualitative research. So summarize this question. If you ask what, it will meaning identify what happening. For example, what students face, challenges students face. How, it will give the processes and experiences. How does it happen? How do students cope that particular challenges? Why, reasoning. Why does it happen? So if you ask why, it will give the reason and meaning. So in qualitative research, asking what, how, why help to researchers deeply understand issues, human experiences, behaviors, and motivations. So these questions together create a complete story of the people's perspective experiences. So give one other example. If so, what system you prefer in diabetes? If you ask this particular question to any person, what system, what medical system you will prefer in the diabetes or in your this particular problem? If the person may I go for the particular answer, I will use the Ayurveda allopathy. Then, so our question: why people are choosing this particular system in this particular health condition like diabetes? Then, the my study question is diabetes and Ayurveda. Then how the Ayurveda will how Ayurveda system is attracting? What is the process? Why people are coming to take the treatment for that particular disease? Then why questions use the because the people may aware about of the Ayurveda drugs benefits, or they may aware about the side effects of the modern medicine. So why the people are shifting to Ayurveda to gain treatment for that particular condition. So how why, and what. These are the three main questions we will use in the qualitative research to gain the complete story of the people's perspective and experiences. So what is qualitative research? I have already shared this particular video. If you go through this particular video, you will clear whatever up to this, whatever I explained, that same thing is explained in this particular video. So you may more clear what is qualitative research if you go through this particular video. That's why I have kept here. So later on you can go through that particular video. So now to understand qualitative research, we should know the differences between the qualitative and quantitative research. So if you see the characteristic of quantitative research, the quantifiable means in quantitative research, what we will do, we will focus on the measurable data like surveys, statistician, health outcome members, imagine counting the number of flu cases. So whatever things you use, we use for measurable data. So height, weight, blood pressure, any serum level, HB level. So that kind of measurable things we will do in the quantitative data, that is quantifiable in the quantitative research. And reliable means if you do the particular study in your settings, the same settings, if any other person in any case, if we do same study, the same result should be uh, there in that particular study. If you conduct in India for same setting, particular study, if you conduct in the same settings in the any other place, the result will be same. That is the characteristic of quantitative research. Then generalizable, most important is most of the time the results available from the quantitative research can be applied to the larger population. Generalizable. So what we generally why we take adequate sample size, from sample to population we will apply that result. So quantitative research are generalizable. Then decontextualizes process focuses on what in quantitative research, focuses mostly on what and how much. The quantity is important, how much questions. So missing the why it will happen, it will be not there in the quantitative research. It will most of the time it will focus on what and how much people will spend, how much people will take. So the quantitative things it will be clears, but why question will not be done by the in that particular quantitative research. For example, if you conduct a survey, you can get the result the community has the high obesity, prevalence of high obesity by quantitative research. But why the prevalence of obesity is more in that particular place, it will not explain. So that's why what and how much is cleared by quantitative research, but why it will not cover in the quantitative research. Now, if you see the characteristic of qualitative research, it provides the context. Qualitative research context will be provided. So why people will behavior, why people will experiencing the same thing in the different context and different socio-economical background, educational background, geographical background. Based on their context, the perception will change for same phenomena. Then it will give the provides context. Then it will give the why answer for the why. Uh, for for that qualitative researches in qualitative research we will conduct interview, focus group discussions, observations. So by this we will reveal what are the beliefs, motivations, and social factors influencing the research topic, that particular research topic. So if you ask any particular question like the, if in some people are hesitating the taking the vaccine, if you ask this question why you are not taking the vaccine, so different people may give the different answer. Someone have give the answer like I have allergy, and someone give the in our religion it is not uh, in not possible, or their beliefs, and some people we are not affordable to take that particular vaccine. So in the different context we will get the different answers are different perceptions. So it will give the different context and it will give the answers of why. And in qualitative research, generalizability is major issue. So findings, whatever findings we get in the qualitative research, cannot be generalized to the larger population, but it will give the specific. If you can generalize it for specific groups and specific situation, you can generalize. But as quantitative research, you can generalize. That type of generalization will not be there in the qualitative research. So up to this, is it clear what are the characteristic of qualitative research and quantitative research? Is it okay?
Yes, sir.
Okay. Then, so when to use this qualitative research? Many of us don't know when to use qualitative research. Even I also know qualitative research are not done by health field, and even I have not seen before any papers in Ayurveda people research. They may be papers are research, but I don't know. So when to use this is more important, because if you know when to use qualitative research, then you may do the qualitative research and more qualitative research may happen in our field. So explore feelings or experiences. Understand deeply how people feel or experiences something. Example, how do patients feel after receiving difficult medical news? So for example, difficult medical news means, if I diagnose with some particular disease, so how I feel, what is my feeling toward that particular news? What is the difficult? I have to take that particular disease I have. So that kind of difficult feelings and experiences cannot be done with the quantitative research. It should be qualitative research only. For example, in what is the what kind of problems you seen, or what are the problems you experienced in the COVID time? So the person who suffered from COVID-19, they only tell what is the real problem or what is the real difficulty they have faced. Simply by seeing COVID patient, it is not possible. It is experienced one. So the how to explore that kind of things, we need the qualitative research. And understand reasons and motivations. Why people in COVID time, why many people are shifted to Ayurveda, they are not taken the vaccines and they are more gone for the this Nasya and Chavanprash and Ayurveda regimens. Why people decide to take these kind of things? And even though lot of guidelines, people they find their way to get rid of COVID-19. People take this steam and they use some home remedies. So in their way, they are trying to get out from this particular situation. So why people are believing that kind of things? So if you want to know reasons, then you will go for the qualitative research. Even though WHO, this particular thing, even modern medicine has even health departments also giving, you should take this particular medicine, vitamin C, zinc. So that kind of medicines, even though they are giving guidelines, people are not, many people are not taken. They are not who dare to take that particular guidelines. Why people think it is dangerous, this particular medicine is not working, these are the useless. So here the individual, every person have his previous experience, and based on their knowledge, they have the different kind of perception. So to understand reasons and their motivations, we have to do the qualitative research. Then study complex issues. So some complex issues, social issues, health issues, we cannot find answer for that in the quantitative research. We have to go for the qualitative research and develop new ideas or theories, to generate new kind of theories, and where the understanding is very limited about that particular phenomena, we have to go for the qualitative research. So developing new approach or new kind of things, the qualitative research is helpful. And examine the context or culture. So how cultural background affect the patient's understanding or person's understanding about the health, because we are a health related persons. So we are interested in the health related events. So how cultural backgrounds, how that particular context. So in rural villages, if females are suffering from any disease, they are not coming to the OPDs because there is a cultural background is there. Without their husband, they will not come to the hospital. Still in villages also, even though they are suffering from severe diseases, they are not able to come to clinics because their husbands are outside the city. Are they? So if the husband or any other person is not there with them, they will not come to the health facility. So this kind of context why people are not coming for the health or any particular thing, we can understand by doing the qualitative research and evaluate the programs and intervention. So like malaria, national vector-borne disease control program, blindness control program, tuberculosis control program, a lot of programs and awarenesses campaigns are there in our India health programs to develop or create the health awareness and prevent a lot of disease like tuberculosis. Still, the tuberculosis is the major burden to India. So why, even though extensive programs providing free drugs, free testing, free diagnosis, so a lot of things, even government is giving district tuberculosis officers and testing and newer things, facilities are given by government, but still the tuberculosis is burden for India. Why? The programs are not reaching the people, end users. So to understand this, evaluate the programs or intervention also, we can go for the qualitative research. So even though we will, for example, even though Swarna Prashana in Ayurveda, Swarna Prashana is the one of the best practice to build the development of child. So many people are not aware of this particular thing and they are not coming for the Swarna Prashana. So why complex things? Why they are? So this kind of programs or intervention, why the people are not taking or why it is not reaching the persons? We can go for that type of situation also, qualitative research. So now we will start qualitative research approaches. The qualitative research have the many kind of approaches. Around 20 kind of approaches are, you can take it as a types also, but in they are used in the sociology and other branches, but related to medical field or health research, we have 5 to 6 approaches. We will discuss that approaches only because that much this detail we don't want and we will not able to do that kind of approaches also. That's why we here I will taken only 5 to 6 approaches that will help to do the qualitative research in the health field. The first one is ethnography, second one is narrative research, third one is phenomenology, fourth one is grounded theory, qualitative description studies, fifth one, and sixth one is case study. So these approaches generally we will use in the health research. These qualitative approaches are qualitative research types. You may take qualitative research types, ethnography type of qualitative research, narrative type of qualitative research, phenomenology qualitative. So you can take this as a types of, these are the qualitative research approaches to do the qualitative study or qualitative research. Ethnography, these are most of the time used in the health research. That's why these types or these approaches I am discussing here though. So as the sequence I have changed, I have taken this material from the different sources. That's why my PowerPoint is entirely different for every slide. So because it is a wide subject, which point I have to keep, which one I have to remove, one. So everything seems to important to me, but some concept I have not included because they may create confusion because in 2 hours it is not possible to clear that concept. So that's why that concept I have not keep here. So I will explain most important and basic one here. So first approach is ethnography. Ethnography qualitative research. So what is ethnography qualitative research? So please watch this particular video. Next, I will explain what is ethnography. Is it visible? Is it visible?
It's visible but not audible.
So actually, what happens, the audio is not sharing by this Google Meet. So that's why I am just playing video. I have tried to share audio,
Okay,
but
sir. Okay,
I am not getting that
okay, sir. No
particular
problem.
option here. Uh, uh,
No problem.
okay, just all of you seen, most of the people seen this particular scene, but just for to make this concept clear, I am using this particular video. Just go for 2 seconds. Many of you seen this particular video, so that's why I am. So, what is the why I am showing this particular video is in ethnography study. If you want to know the special, you want to understand the people lives and cultural, you have to go beyond the interviews and surveys. So explore the real life experience. You have to become part of that particular culture or that particular people, and to spend time with living with that particular community, and you carefully watch how people will talk or what their stories, what sometimes their you will study their stories, and if any documents are there, you will see the documents. So you will become the part of that particular social phenomena, and we will study for that particular thing to understand the what are the problems. So this particular video, the king came to the village as a common person, and then only he is able to understand what are the actual problems the people are suffering in that particular his kingdom. So that kind, if you want to understand different cultures, different problems of that particular places, or any special social group is suffering from that particular problem, then you have to go and live sometimes with them, and then you will understand what is the exact problem. For example, in any tribal people are suffering from any health issues or any educational issue or anything, the people will, or the researcher will go and stay with them, and they will study about the that particular problems related to that specific social group. So this is ethnographic qualitative research. So benefit here is it offers deep insight into people's culture, motivation, their challenges, helps you see the world from other perspectives. So as you are a part of that particular situation, you can see what is their perspective. Here the king he is seeing how the rate of that particular in market, how the rate is increased, why the rate is increased. So that kind of things he observed. So the pursue, how people will pursue about that particular thing. So like that, how people will pursue our health research activities or health related events or medicines or anything, how people will pursue, or any particular problem the particular community or social group is suffering, why they are suffering. So to understand everything, we have to go and part of their life and we will do the study. This is called ethnographic studies. So in the health aspect, how we can do this ethnography study? If you want to check the hand hygiene behavior in the hospital setting, you can go to that particular hospital setting. As you are the part of that particular hospital setting, just you will observe how the hand hygiene the nurses are using, the patients are using, the doctors are practicing hand. So these kind of things you will come to know only by qualitative research, especially if it can be done through only observation also. And if you want to see more deeper, then you can go for the ethnography, as you are part in that particular ward or hospital, and you will observe by becoming the part of that particular setting. So attitude towards the biomedical waste disposable, hospital staff behavior in ICU, attendant behaviors outside the OT, how medical students spend time in the hostel. So how medical students spend their time in hostel. If you want to study this, then you have to go for that hostel, and you will stay and you will observe and you will document how the students will wake up, what they will do, how much they will study. So to know in detail, so you will do ethnographic study. It is not only like that you will go for only uh, um, that particular community. So in our health field, we can use this ethnography method in this way to understand our problems, health related problems or health medical research related problems. Ethnography can be used. As we are not sociologists, we are not going to any tribe community or any particular community to understand their social or other problem. As a health person, we can use this ethnography qualitative methods to understand these kind of phenomena, how people are behaving at blood donation camp. If you want to study this kind of thing, you should go blood camp as a participant, and you observe, and you are the part of that particular group or situation, then you can do the study. So this kind of application we have to do in the health research. So here research question is, what are the shared practices of that particular culture or organization in the was ethnography. Our research question is, what are the shared practices of culture or organization? Sampling. Here the people who are doing those practices, they are taken in the sample. So sampling, if you are interested in any particular practice, for example, hand hygiene, so you have to take sampling of that particular people, those doing that particular hygiene. So, for example, how nurses behave in the ICU. So then you have to go for that particular setting, and the nurses, those working in the ICU, are the sample of your study. So sampling is people, those who are doing those practices. Data collection. Data collection you can do by observation or one-to-one interview, focus group observation, and by simply by seeing documents. So in a qualitative research method, there is a no restriction and there is a no hard rule like that. You have to collect data by single method only. So you can use multiple methods. If you are doing qualitative research, you can observe. That is also okay. You can take by interview data, or you can do the focus group observations, and you can analyze certain documents available for that particular study. So it is very flexible one. So data analyze here, ethnography is constant comparative thematic analysis. So when you will study about analysis, you will analyze thematic analysis. I will not explain and confuse you here what is thematic analysis. Just I will give idea what is thematic analysis means. Whatever data you collected, you will code that particular uh, description or transcription. Then the code will be merged as a particular uh, theme. So final theme, what is whatever final conclusion meaning of that particular study comes. The study have different kinds of themes. So it will be better understood by in the analysis part. Just you have to remember, data analysis will be thematic analysis in the this ethnographic study. So next one is narrative research. So what is narrative research? Here the we collect the personal stories and experiences of the one or two individual only. So, for example, uh, anyone get survival of cancer, final stage, whatever thing. So we will take the experience story of that particular person and we will narrate. Here, narrative research, we will take one or two individuals only. In narrative research, it will be uses detailed interviews. Interviews. In here, we will take the interview of that particular person around week or months or years, and the stories are organized creatively, and we will give in the highlight the important themes. And what is the benefits of narrative research is reveals the deeper meanings behind the personal experiences. If you are doing qualitative research in other methods by other methods, it may not give that much deeper, but in narrative research, as we are taking only one or two person or one or two people, we can go deeper to that particular phenomena, and it identifies the common themes and challenges pattern in the life, and it will uncover insights that relate to wider social and cultural context. For example, the person who if you are taking one particular narrative, doing one particular narrative research, the person taken 2 doses of COVID vaccine. The person has taken 2 doses of COVID vaccine. In spite of taking vaccine, he suffered from COVID-19 very severely. So now he is a survivor of COVID-19. If you want to take the experience, what is the meaning, what is the things about that particular COVID-19, he will give the better experience. How they take the vaccine, which interval, even though taking vaccine, how he get the COVID-19, what are the things. So his perception experience is different. So now we can give the deeper meaning of that particular phenomena, even though taking vaccines also, how these persons suffer and what are their problems, what the mental state, even though taking vaccine they are suffered from COVID-19, what is the mental status, what are the experiences feeling of that particular people in that time, we can narrate that particular person's experience. So that is about narrative research. So here one or two people's opinion, or we will take the one or two people. So some common narrative research are biographical narrative, autobiographical narrative, personal history stories, and oral histories. So these are the some types of this narrative research. I will share the papers, but narrative research generally we will take the personal history stories or oral history in our health field. So other two, biographical, autobiographical, used in the sociology and other fields. So, as an example of narrative research, what is it like to climb a mountain with an elevation of over 20,000 feet? For example, any people, those who are doing the mountain climb, so climbing the mountain. So, if you want to take the do the research, what is like to climb a mountain, why they are going for that particular mountain climbing. So, that kind of interview or research you are doing, that is the narrative research. They will explain about their interest, their experiences, why they are doing that. So that is the narrative research. So research question here is, what is the story of lived experience? So which experience you want, that is the research question. If you want story of lived experience from COVID-19, vaccinated COVID-19 patient. So like that. So people who contribute to story of their experience. Here sampling is those people who want to contribute their story or experience. They are the sampling. Data collection method here is one-to-one interview. We will interview that particular person and we will observe, and some documents related to his experience also we analyze. So data from these three things we can collect and we analyze in the narrative research. So data analysis is narrative analysis. So just remember here, narrative analysis will be done in the narrative research. So point to remember narrative research here, the strong relationship between researcher and participant is needed, because the person is expressing all the personal things, whatever his experiences, whatever problems he thinks, very everything he is deeperly explaining to the or sharing to the researcher. So that's why the strong relationship should be there between the researcher and participants. And researcher here plays very active role, because a researcher should ask the questions and he want to continue that particular interview, how you would get, what are the problem you uh, 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 face that time. So this kind of researcher is, should be active, then only the people will give the all his experiences about that particular thing. And interview is the most common method of data collection in the narrative research. As example, any if you are taking the narrative research, so interview method we will ask how, why. So interview method will be many, all of you know about interview method. So we'll use the questions and we will ask the open-ended questions and we will question and we will have the probes, and we will take the information randomly. It will not a, it is not a sequential order. We will take the interview and we will entry his experiences, and we will also recording that particular interview by audio or sometimes video also by taking the consent. So this is about narrative research. Next one is phenomenology. So what is phenomenology? The studies people personal experiences, how they pursue the world, focused on the individual perspective and interpretation. So here it looks like similar like narrative research, as here also phenomenology. We use the lived experience. What is live experience? Lived experience, the people who suffered from the myocardial infarction. So if you want to study on the myocardial infraction population, how they feel, how, what is their experience, how they came to know about their heart, they get the heart attack. So like that, here the person who suffered from myocardial infarction or heart attack are the participants here. So here phenomenology, what we will do, so lived experience persons, the number of people are more here than narrative research. In narrative research, we will go interview method and only one or two people's experience we will take in the deeply. But in phenomenology, we will take the group of people, their lived experience about particular phenomena, we will collect and we will analyze the that particular phenomenological or whatever the participants give the information, we will analyze in the later on. So the difference between narrative and phenomenology is narrative research have only one or two participants, but phenomenology we have 10, 15, 16, around 20 people also. So phenomenology is lived experience. For example, uh, the person, if you want to study about what is the experience or whatever problems filled in the cesarean section. So here you cannot take the women's those undergone the normal delivery. Here your participant should be those who undergone the cesarean section. So here your interest is about what are the problems, difficulties faced by women after the cesarean section. Then to know their experience, their opinions, their inputs, you have to collect, take the interview, or you have to collect by focus group methods also, you have to collect data from those women undergone the cesarean section only. So that is the phenomenology, the people who undergone that particular phenomena, you have to collect data from that particular people, then it is called as a phenomenology. So it is a live experience event as pursued by the individuals. It is something that people have direct conscious experience of and that hold the personal meaning. So if you ask the what are the complications or what are the difficulties facing by women after the cesarean section deliveries, so each and everyone give this some personal meaning. After the cesarean section, I am feeling very weak. My lumbar pain is not there before cesarean section. Now my thighs are paining. So different personal meaning is there also attaching, or the that is the that holds the personal meaning or significance for them. So before this cesarean section, I am very fine and I am fit, but after this I am feeling this kind of thing. So the personal meaning they will attach in the this particular phenomenal study, but it is very significant to understand why people are believing or pursuing cesarean sections are not why how they are giving the health related issue in the women. So this kind of things we only come to know after the, that's why many women will reject to make the cesarean section, because they heard the opinions of other women who those who undergone the cesarean. So to understand these kind of things, we have to go for the phenomenology type of qualitative research. So this is same thing here. Your if you focuses the understanding the essence of these lived experiences or events, then it is what it feels like, how people interpret it, how they describe it. Then your research is phenomenology. You are doing the phenomenology type of qualitative research. Please watch this. So this is about this particular video about the woman suffered from breast cancer. Here, the breast cancer is my problem, or I want to study about breast cancer. Then I want to I have to interview the patient or woman suffered from the breast cancer. So this is about phenomenology. So this is the interview method they are conducting. I will share this particular video just to understand the concept what is phenomenology. So I have shared this. Can you see their expression? Even they try in between while sharing their experience. So they will attach their personal meaning and problems, and they will explain in the phenomenology. So that is the importance of phenomenology. So lived experience of the persons. So this is about phenomenology. So any doubt up to this? What is phenomenology? So this is research question. What is the essence of phenomena of interest, and people who have live phenomena of interest, and one-to-one interview or focus group or observation documents. These are the data collection methods, and data analysis will be phenomenological analysis. We will done in the phenomenology study. So these are the some papers. A phenomenological study on the experiences of patient transfer from the intensive care unit to the general ward. The patients how they are feeling, how they are experiencing if they are shifted from ICU to general wards. So the phenomena here is shifting the ICU to general ward. You can only take those patients those who are shifting from ICU to general ward, so then it is called as phenomenology. Then lived experience of patients with COVID-19 infection, a phenomenological study. So this is about phenomenological study. Then next one is grounded theory approach. So what is grounded theory approach? Just I will show 2-3 seconds this video. I have already shared in the group. You already watched in the. So here this particular video it is used for just for understanding purpose. Here the president of America is killed by some person. So who is the that particular killer? They don't know. So they are looking from different viewpoints. Many people will tell that I have seen that particular thing. So like that, they are collecting all the person's observations, and they will uh, try they to identify the killer. So the similar thing will happen in the grounded theory. We exactly don't know what is the exact exactly don't know what is the reason or why these things are happening. So based on available observation, available data, we try to develop new theories, creating new theories from the existing collected data directly. So that kind of things we will do in the grounded theory. Generally, in health research, grounded theory will be very uh, not used widely. Some situation we will use the grounded theory. So in grounded theory, it differs from collecting the data. So initially, what happens? You will suspect one person, and you will take the interview of that. You will inquire that particular person. Then you came to know that this person is not killer. Then he gives this some clues. Then you will go for that particular evidence. You will analyze that, then finally you will get the who is the killer in that particular video. Like that in grounded theory also, we will collect some data and we will develop some theory, and we feel that this is not giving a proper meaning of this particular problem. Once again we will go for the collection of data by changing samplings or by doing other method. Then once again we will create the some theory, and until we get the final theory or satisfactory reason, we will go on collecting and analyzing the data. So that is the grounded theory. So when should we use the grounded theory approach? When you wish to derive a new theory for a research question, or when you wish to fill the gap in already existing theory for a research question. So this is the method grounded theory will be used. So when should you use grounded theory approach? When there is a no existing theory to explain the phenomena. If any of the existing theories are not explaining that particular phenomena properly, then we go for the grounded theory. Then there is an existing theory. There is a theory present, but that is not used, derived, that not complete. We feel that theory is not complete to explain that particular phenomena. Then we will go for the this grounded theory. So with grounded theory approach, theories are derived from the real world data, then data collection and analysis in iteratively. So what is the iterative process in grounded theory? We will start the data collection and we will analyze the data. Then we find the results are theory we want to generate, or we are not satisfied with that data analysis. Once again, we will generate one theory by data analysis, but we are not satisfied. Then we will go for once again we will go for data collection, and we will analyze data, and we will generate another theory. Then that is also not satisfied. Then we will go for the data collection and data analysis and theory generation. So this cycle will continue in the grounded theory until we find the proper theory that explains that phenomena. This process will be repeated: data collection and data analysis. So this is the this makes somewhat different approach in the qualitative research from other research. Here data process is iterative process. Simply we are not collecting data and analyzing, and we are not creating a theory. So until and unless we get the proper reason or proper theory for that particular phenomena, we are keep on doing this process repeatedly. That's why it is called as iterative process. So here we will go for the first and second level coding. That's why grounded theory are very extensive, and we have to give more time and more experts are needed. Usually grounded theories are not done conducted by the health research. Uh, uh, so only some specialists or the experienced persons are doing the grounded theory. So the theory or explanatory framework, you can explain how communication barrier occurs in healthcare settings. So this is the example. Initially, we seen what are the communication barriers in the doctors and patients. The existing theory explaining about barriers, communication barriers, you are not satisfied. You want to develop new theory why the communication barrier is there. Then if you go for the grounded theory, and you will get the new theory why there is a communication problem is there between the patient and doctor. If you want to generate a new theory, you have to go for the grounded theory framework. So iterative data collection I have explained already. you are collecting more and more data to refining your questions and focuses based on the what emerges. So that is the iterative processes or grounded theory. Focuses on the processes and actions, generating new insights. So one of the example I will show here, because rarely I have seen the papers are there grounded theory, but even I feel in Indian context we use this grounded theory. For example, tuberculosis program. I found this from one of the book. So why tuberculosis program is not successful in India? So initially they are conducted some study. They will give the analyze that particular data and do the theory. These are the things why tuberculosis is not successful in not getting successful in India or not achieving as they wanted. So like that, if that particular theory is not satisfactory, then you will go for once again data collection, data analysis. So finally, until the particular theory or a particular reason that is more appropriate to understand why tuberculosis programs are not reaching everyone, to find out, until that we are keep on going this particular study. So this kind of program evaluation, we will use the grounded theory in the our health research, but it is not commonly used in the health research. So this is one of the uh, example I have taken, evaluation of this tuberculosis program, grounded theory. They have used the grounded theory. So just this is the difference between grounded theory and phenomenology. In phenomenology, what we do, it is open-ended questions and experience-oriented. But in grounded theory, it is process-oriented, action-oriented, focuses on understanding how and why things happen. But in phenomenology, what we do, we take the experiences of lived persons. In phenomenology, we ask questions like, how do you feel when communicating with healthcare providers? Can you describe a time when you felt misunderstood by a doctor? Then what is like for you to experience communication difficulties in a healthcare setting? The questions are more like you, about experiences and knowledge about that particular phenomena. But in grounded theory, how do communication barriers develop between healthcare providers and patients? So this kind of questions will provoke us to create new theories or the bridging the existing theory gap between this to understand the barriers between the health providers and patients. So in grounded theory, we will ask question like this: how do you communicate? How do communication barriers develop between healthcare providers and patients? What factors contribute to the misunderstanding during medical consultation? What strategies are used to overcome communication challenges in healthcare settings? The questions more helpful to develop a theory. That kind of questions we will ask in the grounded theory. So next one is qualitative descriptive studies. So up to this, are you getting what I am explaining, or is it confusing? I am making more simple and not taking any medical terminologies and everything. Just as to understand what are these approaches, I am explaining in very simple way as I understood. So is there any difficulties, or are you getting clear, or what idea? Just I want to know whether you are getting idea what are these approaches or not. Hello, hello, I am audible. Hello, hello. So the next one is qualitative descriptive studies. So it is simplest and easygoing qualitative research. As a researcher, you only need to describe a phenomena. So this kind of design we will use. Sometimes it is not possible to fit our qualitative research in grounded theory, phenomenology, or narrative research. Then we will use this qualitative descriptive design. So this is the simplest one. Here we only describe the phenomena and we will explain why this particular phenomena is like this. So only superficial thing we will do, that is the qualitative research. Here our research question is, what is the phenomena of interest? Purposive sampling. Here purposive sampling we will take. What is purposive sampling? I will explain. So those who have any idea about the topic, for example, if you want to do the qualitative descriptive research, for example, what is the benefit of Amalaki people perception? So those who know about Amalaki, you can include all of them. So that is purposive sampling, and those who have idea about that particular thing, you can add the that particular people in the sampling. Then data collection, one-to-one interview, you may go for one-to-one interview, focus group, or simply observation. Here data analysis method will be content analysis plus descriptive tables. So as a researcher, you do not move from the data while analyzing. For example, why qualitative descriptive study design is important. Here we are not going in detail. We only just how the things are going in the that particular phenomena. We will take the essence of that particular study. We will not do the interpretation. We will only describe that particular thing in the qualitative descriptive study. For example, strategies and challenges in Kerala's response to the initial phase of COVID-19 in pandemic, a qualitative descriptive study. If you go through this particular paper, how they have selected sampling and how the methodology is done, you can go through this particular paper I will share after the workshop in the group. So see, the objective of this particular paper to understand the structure and strategy to help the Kerala in fighting COVID-19 pandemic, challenges faced by the state and how it was tackled. So design qualitative descriptive study using focus group discussion and in-depth interview. Here they have used focus group discussion and in-depth interviews. Setting in the Kerala state, they have done participants, 29 participants, 4 focus group discussion they have done, and 8 in-depth interview they have taken. The participants are from Department of Health and Family Welfare, Police, Revenue, Local Self-Government, Community-Based Organization, District Panchayats, Primary Health Centers are selected, and how they are done uh, uh, involve the persons to focus group discussion and interview they have given, from which the persons are taken the purposefully they have given. The participants were chosen purposefully. So because the sampling method here is purposive sampling, and they have done this particular study. See results. What are the results? They have given the study identify 5 major themes that can inform best practices: social capital, robust public health system, participation, and volunteerism. So the result they have given in this particular 5 theme, and conclusion. The study shows the impact of synergy of these themes towards more effective solution. However, further research is much needed to examine the relationship between these factors and their relevance in the policy decision. So this is about qualitative descriptive studies. Then mixed method approaches. In some studies, we will use the both qualitative and quantitative methods. Then it is called as mixed method approaches. For example, a mixed method research study of parental perception of physical activity and quality of life children under home lockdown in the COVID-19 pandemic. If you go through the research paper, you will understand exactly how they will do this particular methods, mixed methods. So I will share one research paper as an example for each and every method. After this session, you can go through that particular paper. You will understand the whatever we discussed here. In case study research here, it is not like that single case. Here is not a patient. Here the only one person or a single. The whole system can be considered as a single system, or the whole nation can be considered as a particular single unit, and the study will be done according to that. Then they will give the results. For example, case study in Patanjali. What made Patanjali Ayurveda a massive FMCG firm? So Patanjali, how the Patanjali become this kind of FMCG, how the why the Patanjali products are selling. So this kind of study, if you are doing, then it is called as case study. Here, the Patanjali a whole company or manufacturing unit is a case here. So we are doing the case study of Patanjali Ayurveda or of why sales. If a person belongs to the economics, he will think about sales and marketing. If you are a health research person, your objective or research question about why, whether the people are getting benefit from medicines of Patanjali Ayurveda medicines, or what things, why Patanjali medicines are selling more. So this kind of case study you can done in the this particular qualitative research method. In nutshell, we can summarize the all the approaches. Narrative research is for one or more individuals who want to share their life story. Phenomenology, several individuals we include share the same experience. And grounded theory, a process and action. It involves the many individuals. Ethnography, a group that shares the same culture and you will become the part of that particular group to study the ethnography. Case study is an event, program or activity. More than one individual, you will provide the details about that particular research. Here, one thing we have to know, for a particular research problem, we can apply many approaches. There is a possibility to apply many approaches. If you are taking the only 1 or 2 person's lived experience, then it comes under the narrative research. If you are taking some more people, then it comes under the phenomenology. So like that, you can take the many approach to your research problem. That is the flexibility in the qualitative research. So regarding sample size and saturation, so there is a no predetermined sample size in a qualitative research. As we do in the quantitative research, so to calculate sample size, we need the prevalence. So other kind of information to calculate the exact sample size, prevalence, and the mean differences. So power. So we need to calculate sample size in quantitative research. We need that particular thing. But here, no such kind of rules and regulations. You can take sample size as per as your study need and your it is depend on you only. So data collection and analysis usually concurrent, means you are interviewing one particular person today and you are making the transcription that time only. But in quantitative study, what we will do, until and unless we complete all the participants intervention, at the later stage we will analyze the data. But in here, qualitative research, you can concurrently do the data collection and analysis. And you have to collect theoretic data until theoretical saturation. So what is mean of theoretical saturation means the repetitive answers. If you are coming from the your sample, then you think that your sample is sufficient. If you are conducted 10 or 15 people interview, then the answer or experiences are coming same, like each one after the certain number of interviews, then you have to decide there is a saturation. So even though I will take some more interviews, the answers or experience are coming same. So this is about saturated point. Now it is the sample size of this particular research question. So this is about sample size and saturation. So up to this, any doubt, any confusion, you can ask here only. We have half an hour, so I will go for that particular website and explain you that particular course, how you will get certification and other some uh, parts of this qualitative research. So any doubt, any query or any confusion, can you ask? I want to continue. Please reply. Hello. Hello. Hello.
Yes, sir, you are audible, no problem.
Okay. Hello.
Hello.
Can I continue, or any doubt or any clarification? Because if you are already studied qualitative research, it will be easily understand. But first time, if you are Anyone adding these things, it may little bit difficult to understand. So you may go recording and further readings, whatever I provided, you may clear. Still, if you have any doubt or any question, you can ask here, because next I will go for the sampling and other things. If you not clear here, you may confuse that. That's why I'm asking. So any doubt or clarification or any things you have to share here.
Sir,
Ma'am.
can you conduct this type of study in the PG?
Actually, PG we can conduct, ma'am, but yeah, a lot of ethical and many people will. The other people also should know about the what is qualitative research, because what practical problems happen, sample size. So in a committee,
Yes.
how you will take this much sample size? They can ask questions, and that may be problematic to that particular PG students. Or you, if we have defending that particular research, qualitative research, then we can do. But the set of people should be there to do the qualitative research. It is not like that, but many people are doing PG and PhD studied in qualitative research in modern medicine. They are in PhD also, the people are doing qualitative research. In PG also we can do qualitative research. There is no problem, but only practical problem is because there is no standard things in qualitative, because sample size and it is flexible also. So that's why sometimes it is practically difficult, because we always want PG to do the give some significant result and definite analysis. But in their qualitative research, we will not give the analysis, only description about that particular phenomena. So if that is possible to do, but many people are not doing in the qualitative research. But you can do, madam. There is no problem, because many people are doing in the other field. That is no
Okay,
problem.
okay, thank you.
So next we will go to the website, that is MFNet, and I will explain some things in the website only. So regarding sampling, whether my screen is visible, a sampling plan is a formal plan. This
Yes,
is
yes,
visible.
yes.
So here sampling is in qualitative research. It is a formal plan that specifies the sampling method, sample size, requirement procedure, as well as specifies in the number of observation interviews, focus group discussion cases required to ensure the finding provides the rich data. So in sampling, how many interviews we should conduct, whether we should take the interviews, focus group discussion, or whatever thing, that should ensure it will give the rich data. So that is the main aim here, sampling plan. We have to do sampling plan in qualitative research to uh, gain the rich data. So what is rich data? How we can do sampling here? Just we can see here. Uh, Broad sampling plan is used to begin qualitative research project to obtain the rich data. You can use the plan to include variety of settings and situation, as well as variety of participants, including negative and extreme cases. So in quantitative research, what we will do generally, if any extreme values or extreme observations we found, we will not include generally. But in qualitative research, to enrich our data, we should include negative or extreme cases. For example, if I ask whether this particular thing is good or bad, so some people will perceive it is good, some people will perceive it is bad, some people are neutral. So to gain enriched data, we have to include the negative percepted person also, positive perception people also, and neutral. So then only we will get the enriched data. So that is the meaning of this, including negative and extreme cases. For example, some for a discussion whether we have to implement this other enabled biometric system in Ayurveda colleges. So if you ask some people, they will tell positively why it is important. So if you are including that people only, then it will not give the rich data. If you include other people, it should not be done, because it will breach our confidentiality. It will use our other data and it may misuse. So that kind of perception is also there to some person. So to do this kind of things, you have to include negative and extreme cases in the study. That is the important. Broad sampling is needed in the qualitative research. The main characteristic of a qualitative sampling plan are here is this particular here I will show. So based on additional questions raised during the data collection and analyzing processes, inclusion and exclusion criteria may be changed or sampling sites may be changed. So in quantitative research, what we do, once in our synopsis, if you write the inclusion criteria, exclusion criteria, number of setting, the site, place, everything, when our synopsis is accepted, later on we can't modify the that inclusion and exclusion criteria. So it is very difficult. But in qualitative research, as you proceed with the research, additional questions, some questions you may find while doing the qualitative research, newer questions you may came to know this is also a problem. So then you can add that particular questions in the data collection and analysis processes time also. Then inclusion and exclusion criteria may be changed while doing the qualitative research, and sampling sites may be changed. Initially you are planning to do the interview or focus group in certain place, and later on that is not feasible or not happening, then you may change the site of that particular sampling also. That's why the qualitative research is feasible, not have any rigid things, because as process goes on, we don't know what problems or difficulties come. According to that, we need to modify our sampling method. Then participants have to be sampled purposefully. So all of you know sampling types, random sampling and non-random sampling. Purpose is sampling and non-purpose, that is non-purposive sampling. So generally in quantitative study, we will prefer the random sampling, simple random, simple systematic random sampling, certified that. But here purposive non-random sampling is preferred because we want those participants who know about this particular phenomena. Purposefully, we have to select that. So that's why it comes under the non-random sampling or purposive sampling. Participants have to be sampled purposefully. I know which person should be included in this particular study. That is purposive sample. The sample is determined by conceptual requirements and not primarily by representativeness. For example, if I want to ask about certain phenomena or certain thing, how yoga will save lives in the COVID-19, then simply I will not take the participants randomly. I will select the participants who know about yoga and COVID-19 or that related things. So the sample is determined by conceptual requirement. My concept here is yoga and COVID-19. The participant who aware about this yoga and COVID-19, that people only I will take as a study participants in my qualitative research. Sample will be developed during the study. So as we move on study, the one people, another people, we will keep on adding. Sometimes what happens while doing the study only, we will came to know another participants by snowball sampling. Sampling means if I conducting some particular interview related to any personal things like how HIV patients are HIV patients and their quality of life, that kind of things, or what are the health issues or problems suffering by these sexual workers. Then if I conduct one or two sexual workers, then they will give the reference about their colleagues or their other persons, those are involving that activities. That is snowball sampling. Then our sample will develop in that type of interviews or studies. So that is the sample will develop during the study also. It is not like that before starting only we have to know how many participants. Sometimes it is possible sample will be developed during the study. Initially one or two participants we will take interview. Later on, based on their references, snowball sampling, we will increase the sample size, or sampling will be increased. Sample size varies by study and it is a typically small. To comparatively quantitative study, the sample size will be very low, around 15, 16, 17, 18. So different kind of approaches. How many participants should be there? Sample size should be there. I will show in later on stages. But there is a no hard and fast rule. This many number of participants should be there as like as quantitative research. So I will explain this particular website. Then you can go through yourself. You can read, because to get certification, you should go for this material. So purposive sampling, if you click here, it will give the description about that particular purposive sampling. Selection of participant based on the researcher judgment about what potential participant will be most informative. Criterion sampling. Criterion sampling means I am taking participant those belonging to that particular criteria. Theoretical sampling means so those who are presenting adequately, that particular person only I am taking in the sample. And sampling, because I will take participants from my college only, my hospital only, that is convenient to me, then it is called as convenient sampling. Snowball sampling, as I explained, if you conduct one person's interview, then by reference of that person, he is giving the another person, then you will conduct the interview in that particular. That is snowball uh, sampling, especially if any drug addicted persons, the people will not tell we are drug addicted. If initially if you find one or two persons, then based on those persons they will give another person's name, though this person is also doing the, so then the sample will increase by snowball sampling. And maximum variation sampling matlab wide range of variation should and wide range of backgrounds. To know about that particular phenomena, we should include the educated participant, non-uneducated participants, participants from different kind of socioeconomic backgrounds to get the enriched data. So whatever sampling method you do, these all come under the non-purposive or non-random sampling methods. So extreme case sampling. So you can go to yourself, you will understand these are self-explanatory. Then what is data saturation? Typically, we will stop when the data is getting saturated. Now we will stop taking the sample. So there is a rule how. So when we will come to know that data is saturating means if you are getting repeatedly same kind of answers or same kind of things, then you are able to understand data is getting saturated. Means the many people are after certain number of participants, the things are coming same from person to person, then we can understand the data is saturated. Then it is the point to where stop the sample, we go for the analysis. That is the data saturation. So you can detail is there, you can go through this. And when you design a qualitative sampling plan, you will work with estimates for each qualitative research category. You will have work with following estimates. For example, if you go for the ethnographic research, should require the 25 to 50 interviews and observation, including 4 to 6 focus group discussions. If you are doing ethnographic study, then in that particular group, you have to conduct 25 to 50 interviews. For example, if you go for the tribal person's health related study, then you go there and you stay there, and in that particular tribal place you will at least conduct 25 to 50 interviews of tribal people and 4 to 6 focus group discussion. So what is the benefit of focus group, what is the merits and demerits, what is the, so these information available in every textbook. Most of the textbook they will give the advantages of focus group, when we use the focus group, that will you will get in the textbook. I'm not explaining here. Just simply focus group means around 5 to 6 or more than 6 people group will be there regarding same condition. For example, if you are doing the focus group of uh, pregnant women, so you should do the group discussion with 6 to 10 pregnant women. So that is the focus group. You are focused with that particular phenomena, and you will by doing rather than doing individual, you will collect the same phenomenal persons, all the pregnant women in a particular place, and you will discuss the that particular pregnant women about their whatever thing you want related to your research question or problem. So that is focus group discussion. Then phenomenological study requires fewer than 10 interviews. So if you are doing a phenomenological study, 10 sample size is sufficient. Grounded theory, you need 20 to 30 interviews. As grounded theory, you are developing the new theory, so that's why it need the 20 to 30 interviews. Content analysis need the 15 to 20 interviews and 3 to 4 focus group discussion. So this is the random some numbers they have given. If you are if you are taking this number, then you can give the reference about this particular thing. So here we have seen this much sample size is sufficient to conduct this phenomenological study. That's why we are taking the 10 interviews. So that kind of reference also we can give, but there is a no clear idea about the how much people we can take in the qualitative research. So qualitative research approaches. So several types of qualitative research approaches. You can go through this particular table, grounded theory. Now you are able to understand somewhat what is grounded theory, what is ethnography, what is phenomenology. If you go through this particular content, then you will understand what is the approaches here. So how we can collect the qualitative data collection method? You can use the participant observation method. You can take the interviews, focus group discussions, and other data collection methods. For which approach, which kind of thing is suitable, you can go through this particular table. For example, participants of observation, participant in the observation of people groups. So this approach, ethnography is suitable, because in ethnography what we will do, we will participate, we will go in the group and we will act as a one among them. So if you are going the participant of observation approach, it is suitable for ethnography type of qualitative research. Grounded theory, it is not suitable, very rare. Content analysis, sometimes it is okay, but it is not more suitable for the ethnography, because participant observation, what we will do in the ethnography, most of the time we will go and stay and we will observe as a participant of that particular community. We will observe and do the research. That's why here it is suitable for the ethnography study. Then face to face interview depths. So if face to face in-depth interviews are suitable for all the approaches. Ethnography you can use, phenomenology also you can do the face to face, grounded theory also you can do the face to face, it is suitable. So this particular table will give the how you can approach for the this particular data collection tool. So here the transcripts. What is transcript means? If you are conducting interview, you will note down what are the conversation happening between the researcher and that participants. So you ask some question, then the patient or participant replies something. So everything will be written down. That is called as transcript. And sometimes what happens, at the same time only we will make the transcription of that conversation, but because of time and other things, what we will do, we will record that particular interview audio recording or sometimes video recording with the consent of that particular participant. Later on we will analyze that particular audio and we will make the transcript from that particular audio. So that is the transcript. So whatever we words can be written and that will be make in the transcript form. I will show the one pattern of the transcript. So reading notes, ordering, interpreting, finding. Just you go one time, you will understand. Otherwise, I will share some videos. I will not explaining here because this is the coding part. Just you have to remember transcript. What is transcript? Coding part I am not taking because it is very extensive and it needs the practical workshop kind of things. So I am not explaining here. So just go to this particular content once or twice, you will understand, you will get the idea about. And strength and the limitations of the qualitative research. Strength of the qualitative research, you can go through this thing. Issues can be examined in detail and depth. Limitations, if you go through yourself, you can understood these things. Then lesson 10, implication to ensure rigor in qualitative research. So in quantitative research, we have the validity and reliability. But in qualitative research, how we ensure that the research is going good, or it is good research, good qualitative research? For that, we have triangulation, respondent validation, and constant comparison. I will briefly explain these three things because these are important. Before that, in quantitative research, we have validity. What is the validity of the research? Finding refers to the extent which findings are an accurate representation of phenomena they are intended to represent. You, all of you heard the validity of the research and reliability of the research in the quantitative research. But here, qualitative research, the validity and reliability we have in the different form. That is, to ensure the quality of research, we have the triangulation use of the method. What is the triangulation? You should use the one or two methods to study the same phenomena. For example, you are doing the phenomenology. So make the participants some face-to-face interview, some focus group interview, some by observation. If you use different kind of methods of collecting the data, then it will ensures the your research is high quality. Then add the participants of extreme opinions and negative opinions also. Then also it will do the triangulation, means different kind varieties of things you have to add by single method or single concept. Without going single method or concept, you have to apply multiple methods and multiple approaches. Then the that is called as triangulation. Then the your research has to be have some quality, or some you are done the qualitative research at the better way. That shows the triangulation shows the your quality of the qualitative research. You will understand. I will share slide also that has one picture. Then you will understand. And respond validation. What is respond validation? After making the interview, you are able to understand this particular person understood these phenomena as a like this. I have came to conclusion. Then to validate that, I will give my understanding to that particular person, and I will ask, I have understood these things from your interview. Please ensure whether these things are really what you want to explain, or whether I am understood you properly or not. So that kind of validation if you do, then the respondent will see our things, and yes, I actually want to tell this thing only, you are written correctly. So that kind of respondent validation is needed in the qualitative research to ensure the proper quality of that particular research. If you go through this particular paragraph, you are able to understand what is the respondent validation. What is constant comparison? Constant comparison means, for example, I am making the qualitative research of Ayurveda students, the scope, and what are the future of after the BAMS students. In my research, qualitative research, many BMS students are giving. Some people are telling there is a salary issue, low salary in the future of. So that kind of output, if I get, whether that is correct or not, I will ask some other people out of the study also. So I have done this kind of studies. I am getting this kind of theme. So are you also feeling or are you also experienced this kind of things in your life? Then the other people are also giving this the same kind of inputs, whatever you get in your research. Then it is called as constant comparison. So this is the unparticipant themes or participant opinion also we take to check whether the result coming in our qualitative research are correct or not. So this is about constant comparison. So this is the checklist. If you are writing qualitative research paper, so what should be there in introduction part, and what is the methods, how to write methods, and what are the sampling methods, how to write data analysis. So this template is given here, and if you download here, the checklists of documents given here, American Journal of Pharmaceutical Education. According to this checklist, if you prepare your research paper, qualitative study paper, it will be acceptable. So they have given here their checklist also. So this is about qualitative research. Then I have also shared you this particular course, Introduction to Qualitative Research, conducted by this MNET organization, Eastern Mediterranean Public Health Network. So how to enroll this particular course and get the certification, I will show step by step process in 5 minutes. Just what you have to do in Chrome, just type MNET, you have to search MNET, click on that. Then here, go to our work option, and in our work option, here go to the e-learning unit. E-learning unit, if you click the e-learning unit, so the description will come. So what is there in the e-learning unit? So can you see here the blue colored one, MNET LMS? So learning management system, the MNET LMS. If you click here, it will go to the LMS. So here above you can go through these English courses. This MNET has Introduction to Qualitative Research, Basic Mindless Citation, and this another course. Just click on the Introduction to Qualitative Research, new. Then here they will ask for your details, name, your college name, whatever name you want in certification. So because I have already enrolled, my that particular form is not showing. So if you click introduction to qualitative research, it is opening because I have already enrolled. But it will not open. It will use the one option, enroll this particular course. So then you have to enter your details, your name, basic details, and you have to create one username and password. Then you submit, then the confirmation email will be sent to your particular email. You have enrolled the introduction to the qualitative research. Then the particular link will be sent with email. Then if you click there, it will be confirmed you are the person enrolled in that particular course. Now you come to this website. Then the first part is introduction to qualitative research. If you click here, it will open the course. So here there are total 11 or 12 lessons here, from introduction, learning objectives, definition of qualitative research, sampling strategy. So if you click and the details will be there. It will be more interactive one. If you click here, it will give the explanation. So like that, it has the very interactive interface. So after completing all the chapters, you will give the feedback, that is yeah, course evaluation. After the completing all the modules, all the chapters, you go for the course evaluation. So if you click here course evaluation, they will give the course evaluation form like this. So I have already filled the course evaluation. So I will just show. So this kind of questions they have given course evaluation. So according to your opinion, you can fill the options. What is your overall assessment of this course, the topic, organization, relevance, everything. So after submitting, you have to submit. Here the one option will come, submit. Then after submitting, if you click certificate of completion, the certificate will be generated. So if you go to the section of certificate, the certificate will be automatically generated. and it will give the certificate. To get certificate, you have to go for all the modules, chapters you have to study, then only you will get the certificate. So you will get the certificate of Qualitative, certificate of completion from this particular template. So be sure whatever name you want, you have to type or fill that particular form. According to that only your name comes in the certificate. So this is about this particular course, qualitative introduction to qualitative research. In 2 minutes, I will explain what is the analysis part, but I am not going in detail. So this is triangulation, what I have explained. Multiple sources, for example, instructors, learners, and managers. So different kind of people, if you include, for example, what are the communication barriers between health workers, health system and patients? If you include doctors, nurses, patients, attenders, so multiple people, their perception about communication barrier, then it will give the rich data. That is the triangulation. So if you use the different kind of, for that study, if you use the interview, focus group, description, and participant kind of observation, multiple ways, then it will give the richness of the data. That one we called as the uh, uh, triangulation. Triangulation is the use the robust findings or richness of data. Ethical consideration, as other studies are there, like that some ethical considerations are there. You have to take the permission from the ethical committee. And while doing interview, you have to record that particular interview. Later on, you can transcript that particular audio. uh, before the before many people are manually transcripting that audio, but now a number of softwares and AI tools are available to convert audio into transcript automatically. So this is the audio file name. You have to save audio file like this: audio file name of the respondent. So without you should not give the name of respondent. Rather than writing the name, you have to create some code, and you have to give the code for that particular respondent to maintain the secrecy of that identity of that particular respondent. Name of the interview, site of the interview, name of the note taker, facilitator, translation done by the participant is from local language, but you are not able to conduct interview in that particular language. If you are conducted interview in the local language, later on you have to translate into English, though the person who translated. So everything you have to mention. So this is how translated transcripted version. Interview asked, can you describe how managing your diabetes impact your daily routine, especially when it comes to following your treatment plan? So this is the question of interviewer. The patient, what patient has answered, you have to transcribe the words there based on recordings. You have to transcribe exactly they have told. You have to write what exactly they have told. An interview, can you describe the how managing your diabetes? Then participant two, what the participant two has given the response. You have to write exactly what the participant told. So nowadays, this AI tool TurboScribe is there. If you upload, your audio into this particular AI tool, it will give the transcription automatically. No need of doing manually. Within a second, it will convert audio into transcription, letters, words. Only thing you have to edit who is the respondent, who is the interview. You have to do that particular part. But nowadays, because of this tool, you have to use this particular AI tool. Then what is coding? Simply, if you are reading this particular paragraph, and this paragraph will be coded with a single word. So I have gone through this description and I coded with this particular word. So I have summarized the whole thing with this particular word. This is coding. Coding is nothing but not giving numbers or not doing any formulas. Coding is we are doing or we are giving some simple word to the their description. So here coding also lot of types are there. I am not going that types, around 10, 8 to 10 types are there. They are need more time and more detailing. Just you have to remember coding is a word we are assigning for the particular explanation to summarize that particular thing in a single. This is code for this particular uh, uh, paragraph here. Also, if yellow color part, this particular portion, I have given code unique situation or green color. So for every part, we are giving the code. So these are the codes. So I thought I was to, if you go through later on this particular paragraph and you will see the code, then you will understand why I have given reality to this particular paragraph. So these are called codes. Later on, how many times these codes are coming repeatedly, how codes are similar each other, then based on that, we will make the themes and then we go for the thematic analysis. This is about brief idea about the coding. For qualitative data analysis, we have softwares also like QDA Miner. This is the free version is also there and paid version is also there. The QDI Lite is the free version you can use freely. Then another one is NVivo. This is also qualitative data analysis software. It is paid only. Only 14 days of free version is available. Later on you can paid, but both are good. And QDL minor light is free one. You cannot you don't pay anything, but it is better option for the data analysis rather than NVivo. If you want to purchase, then you go for this particular software. So this is about qualitative research in uh, health field. So I have tried as per as my knowledge. So any doubt or any things you want to discuss, it will be open for discussion for 2-3 minutes. Then we will end the session. So please respond. Whatever thing you want to ask. If I know, I will tell. Otherwise, I will share the documents or videos related to that. Because 2 hours is not sufficient. Just it is an idea about qualitative research. Then later on, I will also share one workshop, one course, qualitative course. They will doing detailed qualitative research details. If you are interested, you can join that particular course and you will get the detailed knowledge, including analysis, software usage, coding, everything they will give the that particular course. So any doubt? Hello? Hello? Can you give the response whether today's workshop I have made qualitative research, whether it is useful or somewhat beneficial, or your understanding about this particular workshop, whether you get some benefit or not? Please respond. Hello? Hello, or anything you want? I have books related to this research and videos and everything. If you want, I will share personally also. So if you have any doubts, I will wait for one more minute. After that, we will end the session. So can anyone share the opinion or any suggestion? Hello, hello. I think no questions and no questions are there. I will